Okay, so today we are going to run through some shoulder mobilizations. I am going to start with our grade 1 and our grade 4 supine A to P mobilizations of the glenohumeral joint. So for the grade 1s, we're using these more for pain control. So we're just going up to the resistance but not going through. Normally with these patients, I probably wouldn't be bringing them into any type of range of motion like this, but I'm going to with her just so that you can see what I'm doing. So I'm gonna find her joint line here in the shoulder, and then I'm just giving her that A to P force, but with a grade 1, we're just gonna be going up to that tissue resistance. And then our grade 4s are gonna be for mobility. So that's when we would wanna bring them kind of to their end range of motion. And then I like to get a little bit of a distraction, and then I'm getting that A to P, but I'm also getting a little bit of a lateral glide. I feel like that's just a little more comfortable than just going straight down. If we can get a little bit of that lateral component to it, I think it's a lot more comfortable for the patient. Then we're gonna do some inferior glides and flexion. So I'm gonna find her in range. We'll say it's right there. Can you scoot a little closer to the edge? And then I like to kind of use my elbow to kind of help stabilize the patient. And then in that end range, and then I'm gonna tuck my elbow in towards my hip, and then I'm gonna give her that inferior glide here. If she was in a little less flexion, I might want to support with the opposite arm and come in this way, just depending on where she's at in that range of motion. I may need to switch up my hand hold based on where she's at. And then for our quadrant mobilizations, for the external rotation quadrant, you can kind of find where they're limited by bouncing through this range here. She has pretty mobile shoulders, so she doesn't have really a spot that's super limited. So we'll say her limitation was here. I found she's limited there. You can come in, you can do that same inferior glide. You can do the same A to P, or you can even just stabilize the scapula and then work on that range of motion there, pushing a little bit into that stretch. Same for internal rotation. We're gonna come down here. You can even let them go into a little bit of extension. Find a spot where they're most limited. Working on that A to P, maybe an inferior, maybe some distraction in that position depending on where the patient is limited and what activity they're trying to do. Then for our prone mobilizations, for our straight plane P to A, I will get a towel roll to roll up and put just inside the joint line on the chest so that I have room to actually mobilize. So I'm gonna place this right here. And then we're gonna start just in kind of neutral. And same thing as with the A to Ps. I think the P to As are a lot more comfortable if after you find that joint line, rather than mobilizing straight down. I think it's a lot more comfortable for the patient if you can get a little distraction and a little bit of that lateral component to it as well. So we're gonna work there. And then if we wanted to progress into that overhead Faber position, I like to use my leg as a prop to start to work them into a little bit more and more external rotation. Ideally, I would have a stool in here to prop my foot up on. That way it's not as much work for me. And then eventually we're gonna get her into this more functional overhead position. I like to stabilize the elbow a little bit, and then that same P to A in that overhead position there. And that's all of our shoulder mobilizations today.